Hi, my name is Michael Seidman. I'm a medical doctor. I'm a surgeon, I'm a scientist, and I'm a nutritionist. I've been invited around the world to talk about some of the research that we've done, and actually I'm just back from China where I was invited to talk about some of the research. I'm a skull-based surgeon, so I talk a lot about ear surgery and skull-based surgery, but I'm also asked to talk about complementary and integrative medicine as I direct that Center for Integrative Medicine at our health system. One of the things that I think is fascinating is the common cold. There is no cure. And there are more than 200 different viruses that account for the common cold. The most important is the rhinovirus. Adults get about 3 upper respiratory tract infections per year, URIs, or the common cold. Children get about 5 to 7 each year. It costs about $3 billion in consultation, $1.5 billion on remedies, $1 billion on analgesics, and $3 to $5 billion on lost wages. So more than $10 billion a year we spend taking care of the common cold and flu. There are no cures for the common cold or flu, but there is help. And some of this is based upon a fair amount of science, and I just want to briefly touch on that. There was one study that looked at 96 people over the age of 65. It was a double-blind, placebo-controlled study giving them vitamin E and beta-carotene. After 1 year, the treated group had higher T-cell function, increased lymphocytes, and 48% fewer sick days. And what's interesting is actually this is the basis of a letter that I wrote to Donna Shalala and to Bill Clinton when he was the president, saying that I can improve the productivity of the workforce, I can reduce the number of sick days, and I can make people live longer. I do believe I can make people live longer and healthier. And my cynical-minded friend said, Seidman, you had them on increased productivity, you had them on improved wellness and health and decreased sick days, but when you talked about increased lifespan, very much they want people to die at 65 so we don't have to pay Social Security benefits. That was my cynical-minded friends. That being said, there is some evidence that you can actually save a significant amount of money through appropriate supplementation. And this is a study that was done that showed that the potential saving from a reduction in the risk of heart disease and improved immune function with subsequent reduced infection rate by providing adults with a daily multivitamin is $1.6 billion. A lot of money when you stop and you think about it. I want to break down some of the products that are out there just to think about it. I'm not going to mention any specific names, but I want to mention some ingredients. Zinc, for example. It's been shown that ionized zinc has direct antiviral activity. It protects cells from damage by viral toxins. It may even inhibit the rhinovirus that we talked about to attach and enter or infect human cells. There have been studies to show both effect and no effect from that type of an ingredient. Astragalus is an herb that has been used. It's been shown to enhance energy, to increase the resistance of disease by increasing qi or energy. And these become topics that we didn't really learn in medical school when I was at University of Michigan. These are more the alternative topics. Many of these herbs, thankfully, have minimal to no side effects, which is another benefit. Golden seal is another herb, an ingredient that I put in a cold and flu formula that we make, which has been shown to help with mucosal swelling. It's been shown to help with diarrhea and gastritis, wound healing, and immune function. Echinacea is probably Dr. Seidman's pet peeve herb. And I say this because when I've lectured to Congress and I've talked to people on these types of things, when I teach my courses on nutrition in your health factor fantasy, it's my pet peeve herb. Because there are so many different subtypes of echinacea, most people don't realize this. So we know that there is Echinacea purpurea. We know there is Echinacea pallida, angustifolia, and 6 other subtypes, and they keep identifying more. What we also know from the German Commission E and national standards and national databases is that Echinacea purpurea leaf, the aerial part of the plant, works to enhance T and B cell function. The root of that plant does not have that effect. We know that Echinacea pallida root works to enhance T and B cell function, but the leaf of that plant does not have that same effect. We also know that Echinacea angustifolia is a negative rated herb by the German Commission E, which either means it doesn't work, it's dangerous, or not enough is known. If you go to a health food store, I can tell you I did this several years ago, there are 100 bottles of Echinacea on the shelf, I pulled off 10 of them. 9 out of 10 of them had Echinacea angustifolia, which either means that the people making it are not very smart, or that it's cheaper, or that they really haven't done their homework. So when I make a formula, I put in Echinacea purpurea leaf, pallida root, things of that nature. I was actually quoted in Prevention magazine, as you can see here. pretty woman, not my wife. My wife is actually prettier, for those of you who have met her before, but it clearly shows here, be careful what you get, be careful what you use, and I'm very careful when I select that. So we've done some limited studies, mostly with family members, I admit that, but we've shown that we can reduce the duration of the common cold and flu by 70 to 85% in about 85% of users. So the health system that I work with actually has this. They use this formula. Some people recommend it, some people don't. But what we found is the typical cold lasts about 14 days, from feeling lousy to that long, dragged-out cough that people have. And we can usually make the common cold last 2 to 3 days in most people. Not every person, not every time, but in most people. The drug companies have spent over $1 billion on antivirals, and they're thrilled that they can take the common cold of 14 days down to 12.7 days. They knock off 1.3 days. We knock off roughly 10 to 12 days with something much less expensive. So what we've done is we've put together a combination of appropriate herbs, vitamins, and minerals, demonstrated that enhanced T and B cell function in a safe and an effective way. I tell people who have an autoimmune process like lupus, for example, that they probably shouldn't take it because it is an immune modulator. It stimulates the immune system in a safe and effective way. I have a lot of patients who say, I'm always flying, I'm always getting sick. You can take a couple pills before you get on an airplane. I have people who say they're sick from October until May, and so then I tell them you can take it for 5 days on, 2 days off. You want to rest it. Again, don't take it if you have an autoimmune process. It is based upon your weight, the dosing that you use. And I will also tell you that one of the most famous herbal medicine doctors in Pakistan, his name is Jamshed Khan, a very dear friend of mine. Actually, I worked with his son and helped train him in his residency program. Is the most famous herbal medicine doctor in Pakistan. Unfortunately, now he's deceased, but I came up with this formula and he helped me tweak it, so we really have one of the most outstanding formulas to reduce the duration and severity of the common cold and flu. Thank you so much for your attention. Hopefully you'll have a chance to watch some of our other programs.